HIPAA Security. The HIPAA Security Rule establishes national standards to protect individuals' electronic personal health information that is created, received, used, or maintained by a covered entity. The security rule requires appropriate administrative, physical, and technical safeguards to ensure the confidentiality, integrity, and security of electronic protected health information. In simple words, whereas HIPAA Privacy deals with the integrity of PHI in general, HIPAA Security deals with electronic protected health information, ePHI, and is a response to the increasing use of new technology, especially mobile devices. Medical records are worth more to hackers than credit cards. So, whereas the original 1996 Act was intended to combat waste, fraud and abuse, one of the main objectives of HIPAA Security Rule is to protect individuals from becoming victims of fraud and abuse. At the heart of HIPAA is the requirement to protect ePHI, and to keep all healthcare data private and confidential. The divide between what is required for compliance, under HIPAA regulation, and the misconceptions that healthcare professionals have about being compliant is more extensive than ever. The record was broken in 2016 with a $5.55 million penalty for Advocate Health Network over the theft of desktop, laptop and improper PHI access by a BA. The record was smashed in 2018 with a $16 million settlement with Anthem Incorporated to resolve multiple HIPAA violations that contributed to the breach of 78.8 million records. 2018 also saw record financial penalties issued, which totaled $28.7 million. While the Act makes numerous recommendations, it is up to the covered entities and business associates to decide how ePHI is protected. The moment we say, it is up to the covered entities and business associates to decide how ePHI is protected, all of Privacy and Security Rule comes under a great risk. Let me explain how. If you are a young entrepreneur, provider, BA, or a TPA, your entire focus is on business. This results in IT work being contracted out to an IT person or an IT company. If you are an IT company with healthcare clients, the question then is, what is the core strength of an IT company? Obviously IT, but not HIPAA, or the domain knowledge of healthcare. How would you make the IT business analyst, architect, designer, database, and other developers, testers to understand the requirements of HIPAA? HIPAA security rules require IT systems, devices, and software that are capable of touching ePHI must be subjected to a full risk analysis, to ensure that no security vulnerabilities exist, which could be exploited to expose the protected health information of patients and health plan members. What you need to know. If you are an IT or IT-enabled services company, a covered entity, or business associate, or have professional working on healthcare project, or are looking for projects, or consulting work in healthcare industry, clients will now mandatorily ask you to be HIPAA certified. We are iBackbenchers and we train, test, and certify individuals on HIPAA Privacy, and all IT professionals on HIPAA Privacy and HIPAA Security. So, get certified today at www.ibackbencher.com, or if you are unsure, drop us a note at info@ibackbencher.com.